What's a good number of eggs to be able to retrieve?
There is no guarantee when it comes to eggs. That's why we don't love to say that like freezing your eggs is taking out an insurance policy on your fertility. It really is more like an investment toward your fertility. And I show patients these charts that we have that show that there's no single number of eggs that will ever guarantee a live birth down the road, but it can increase your chances of it. And as we get older, you need more eggs to overcome declining egg quality and declining egg quantity. It really is a numbers game, unfortunately, because we know that we're going to need more eggs as we get older.
I'm Susan Yara, and welcome to My Life Online. We're going to have a lot of fun and learn a lot together. If you've ever considered freezing your eggs or going through the IVF process, I feel like there is so much information that we don't even know or even where to start. So for today's episode, I decided to bring on Dr. Adriana Wong. She is a board-certified OB-GYN with a focus on reproductive endocrinology and infertility. She's also known as your Fertility BFF, and she's answering all my questions about freezing your eggs, IVF, embryos, all of the things. Okay. Tell us a little bit about your background and I guess why you call yourself your Fertility BFF.
So my name is Dr. Wong. I grew up in LA here. I went to medical school in Miami, where you live now.
Love it. Okay.
And I did my residency in OB-GYN at UC Davis. And it was then during residency where I realized I wanted to be able to help people build their families on their own terms. So I decided to pursue a fellowship in reproductive endocrinology and infertility, or REI, which is a subspecialty training specifically focused on learning how to manage infertility and also some of the medical and surgical conditions that could make getting pregnant more difficult.
Interesting.
I call myself your Fertility BFF because it's my goal in life to empower and educate as many girls as possible online about their own reproductive health so that way they can make their own plan for their future.
Yeah. I mean, I saw a stat recently, I'm sure you're very familiar with this, where it was something like more women in their 40s are having babies than women in their 20s. Is that right? Is that the right stat?
I think I saw that recently, but we definitely are seeing people having children at later ages for personal or professional reasons.
So that means that more women are definitely taking more control of their fertility for sure, right?
Definitely. And I think it also reflects the way that we're kind of changing and prioritizing education, our careers, and we're also changing the way that we're dating and choosing who we decide to have children with.
For sure. So is there a difference between, I guess, like these major decades in our lives, like our 20s, 30s, 40s, when it comes to fertility?
It's a good question. So age is the most important prognostic factor, meaning like the greatest marker for success when it comes to fertility, unfortunately. So we do know that as we age, our egg quality and quantity does go down. Our fertility is highest in our 20s, and then it starts to decline thereafter. And the reason for that is that we're born with all of the eggs that we'll ever have. And our eggs are also prone to more genetic mistakes, which lead to things like failed implantation or miscarriages. So we're kind of combating these two different things, egg quality and egg quantity, as we get older, unfortunately. But of course, we go off of averages, right? So like not every woman is going to fall on that same curve, but it's something that we take into consideration when we come up with the plan for how we counsel patients for what they should do for their own fertility preservation.
I feel like the conversation around hormones and menopause and perimenopause and everything comes up a lot now. Do you think that's helping women to kind of inform their fertility journey too?
I think so. I mean, I think in general, we just do a really terrible job about like preparing women for these major milestones in their life. Like I was thinking back to what education was like for me. I mean, I grew up here in LA. I feel like I was more or less prepared for my first period, but I still had so many questions about that. I definitely didn't have any education from like my school about what to expect in terms of like what was normal for my period, what might come up as like a red flag for if I wanted to try to get pregnant. I don't think a lot of men grow up or are taught a lot about like what to look for, what to prioritize when they should consider trying to have children in the future. And I have so many friends my age, I'm in my early 30s, who have been on birth control their whole life. And then now they're starting to think about having children and they don't really know where to start.
Right.
And then going into perimenopause and menopause, we certainly do a terrible job at preparing women for that. So there's so many gaps in education that we have to fill there.
Yeah. I mean, well, I had a friend who, it's like crazy, these different experiences I've seen with my friends. I had one friend who is in her early to mid 30s. She just had her first baby, but she decided to get started because she got married. And then I think like 6 months into her marriage, her mom says to her, they're having a talk about menopause. And her mom tells her, oh yeah, I started going through like perimenopause and menopause in my mid-30s. And she's like, wait a second, Mom. I'm in my mid-30s. I'm in my like early 30s. I just got married. Are you saying that I should be thinking about this, that I might go into early menopause or something because you did? Then she's like, oh my gosh, I need to like speed up this process. I don't have all this time to have a baby, and like just starts like freaking out about this. So she went ahead and had her first baby.
Oh, wow.
But then I have another friend, and she's the one that encouraged me to really consider freezing my own eggs. She got a divorce at 43, decided I have always wanted to have a big family, have more kids. Maybe now that I'm single, maybe I'll meet somebody who will want to have kids with me. So she decided right then and there, without a partner, to freeze some eggs. And then at 47 had a baby.
Wow.
With a new partner. Yeah.
That's incredible.
Yeah. With no complications, carried and everything.
Yeah. And I think to that point, I think it's really important to know that like everyone has a different plan for what their ideal family will be, right? So you can't necessarily say like, well, what works for one person is going to work for another. You know, we see all the time that like one 40-year-old might look like this, but another 40-year-old looks like that. There's some 47-year-olds, 48-year-olds who are so healthy and in the prime of their life. So you can't necessarily make like blanket statements about other people's health, but you can give them the information to make the most empowered decision for themselves.
Yeah, that makes sense. So, you know, like a lot of companies these days, one of their like perks, benefits, right, is to offer like help with your egg freezing. Do you think if you're in your 20s, you should just do it? Like even if you have a partner or anything? I see this question come up all the time.
Yeah, no, it's a good question. So I think, you know, on one hand, if you're in your 20s, there's the chance that you might actually never come back to use those eggs. So I guess if you think about like the pros and cons of it, like you might have gone through a procedure with some side effects and some procedural risks that you may ultimately never necessarily like benefit from, right? So I think that would be like one of like the negative sides to doing it. But when we've looked at studies for people who have decided to freeze their eggs but didn't go back to use them, most of the women do still say that they're happy that they did for their own peace of mind. So I think it's individual. Like not everyone has the same like visions or dreams for their own family building goals. Not everyone knows how many children they want to have in the future. So I do think it's reasonable to do it if it's particularly covered for you by your job or your insurance, just because it's more efficient when you're younger.
Mm-hmm. That makes sense. Tell me, so I've learned a lot, just kind of even starting the process of freezing eggs. And I had no idea that your eggs really aren't guaranteed, even if you're in your 20s, right? Like I was reading somewhere that if they thaw your eggs, some of them might not be good and they can't test your eggs. And there's just all these different things that I had no idea that make it seem like, well, I should have as many eggs as possible frozen, right? Can you explain that to people, the process of, you know, freezing your eggs, what to know, and then also the difference between that and embryos?
Yeah. Okay. So starting off with the first part, like what is freezing eggs like? It's about a 2-week process of taking medications where you're self-administering injections and you're coming in every few days for monitoring visits where we're seeing how your ovaries are responding. You're getting an ultrasound, which is a transvaginal ultrasound done, and you're also getting labs. At the end of the stimulation, which is what we call it, it ends in an egg retrieval under anesthesia. It's usually monitored by an anesthesiologist in an outpatient surgical setting. It lasts about 20 minutes and it's all done vaginally. The follicular fluid is aspirated and then we look through the fluid, or the embryologists look through the fluid to find the eggs that were obtained.
Interesting.
Yeah, it's really
I actually
cool.
didn't know that that's how it's done.
Yeah, so there's no incisions made on your belly. It's all done through the vagina.
Okay. So you said anesthesia. That's probably one of the not complications, but the risks that you're taking, right?
Certainly. And that's why we always make sure that you're in good physical shape and you have no medical complications that could make you at higher risk for having outpatient anesthesia.
So once you get the eggs, what's a good number of eggs to be able to retrieve?
So going back to the comment that you made earlier, there is no guarantee when it comes to eggs. That's why we don't love to say that like freezing your eggs is like taking out an insurance policy on your fertility. It really is more like an investment toward your fertility. And I show patients these charts that we have that show that there's no single number of eggs that will ever guarantee a live birth down the road, but it can increase your chances of it. Mm-hmm. And as we get older, you need more eggs to overcome the two things that we talked about earlier, declining egg quality and declining egg quantity. It really is a numbers game, unfortunately, because we know that we're going to need more eggs as we get older. There's a lot of loss along the way. So some people describe it as like an inverted pyramid. So you start off with the total number of eggs, and then they have to look to see how many of those eggs are mature in the lab. And only mature eggs can be fertilized.
Oh, wait, what does that mean? They're not just mature sitting in our bodies?
I know, as mature as we feel, mature eggs are a little bit different. So mature eggs refer to the part of meiosis that they're actually in. So only the mature eggs can be fertilized, and then only a certain number of those are going to be fertilized successfully. Then there's the aspect of how they culture or grow in the lab. We usually let embryos grow for 5 to 7 days under the laboratory conditions, and then they check on them to see how many have developed to that point of what we call a blastocyst. And they're usually frozen. So that's the difference between freezing eggs and embryos. If you're freezing eggs, you're starting off at that top part there, right?
So like I got 10 to 15 eggs in one round. Is that possible?
Yes, certainly possible. So let's say that's how many you got, but you're freezing them there. 10 to 15 mature eggs. So you're freezing them. So that's how many you know. But when you come back to use them later, you don't know how many are necessarily going to survive the thaw, how many will fertilize, all of those steps that I had just mentioned. But if you're freezing embryos, you're doing those steps up front. So you have a little bit more information about like what's in the bank.
Got it. So like if I got 10 to 15 eggs, then we check them, they're mature. Now we fertilize them. Now we can test those embryos that we fertilized, or see how many get fertilized first off. Then the ones that are fertilized, test those to make sure that they're actually
genetically normal.
Genetically normal, not necessarily viable.
Yes. Well,
okay.
We know that if embryos have the correct number of chromosomes, they have a higher likelihood of implantation.
Oh, interesting. Okay.
Yeah, so we can do that. Normally in our bodies, we have 46 chromosomes. And so if we have the correct number of chromosomes, then it's more likely to result in a successful pregnancy.
Okay, so if you get 15 eggs, 10 of them fertilize, then you check them, 7 of them have the correct number of chromosomes, you have 7 potential chances.
If they are normal, yeah.
Okay,
yeah.
Interesting.
But that's why we really try to frame it as there is loss at every step of the way.
I see. Okay. And then with just freezing eggs, could you end up with like 15 mature eggs, but then at the end of the thawing process and trying to fertilize them, end up with like just maybe 1 or 2?
Yeah. And we've seen that some people could even end up with like 0 normal blastocysts.
Oh, wow.
Which is what can be one of the more shocking things. And so when we see people come back to use their eggs many years later, that can be one of the negative things that people say about egg freezing. Like, I didn't realize that this was a potential outcome, or I thought that there was more promise in freezing my eggs. So that's why I try to run through all these potential scenarios with people when we sit down for that initial consult, because people should know about the full range of possibilities and what these eggs really represent for their reproductive potential.
So do you think that if you're in a relationship where you think this is going to be long-term and you will probably have kids with this person, should you try to convince your partner to do embryos with you and like have those safeguards in, right? Like, you can only actually have these babies if we're both together and we both agree and blah, 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 all that stuff, right? The legal stuff, right? Like Sofia Vergara had her legal stuff in place. So she's never had those babies, right? And that ex-husband of hers never had access to them. Do you think you should be having that kind of a conversation?
I think it's so dependent on the couple.
Yeah.
Like, I actually froze my eggs when I was a chief resident because I had coverage in residency, and that was awesome. I was with my partner at the time. Now we're married, but we were dating for about like 10 to 12 months at that point. And I was familiar with the process because I knew I was going into the field. But when you sit down to go through the process of making embryos, you have to make really serious and intense decisions about the disposition of the embryos. So like, if one of us were to die, what would we want to do with the embryos? If we were to break up, or like, if the relationship were to dissolve, what do we want to do with the embryos? Would we allow one of us to use them? Would we allow neither of us to use them? Would we donate them to research? And I think the thing about that is that it can cause a lot of stress on certain couples. And I wasn't ready to have that conversation yet, even though I knew we would probably end up together. And we did. Yeah. But I think that the beauty of freezing eggs is that you don't have to necessarily lock in that sperm source, and you have flexibility in the fertilization later. We actually didn't end up using these eggs to conceive this pregnancy, but we have them down the road if we need to.
Nice.
And so we could.
Interesting. So you're still holding on to them.
Yeah.
Smart.
They're in Sacramento though.
How long can you hold on to eggs?
Well, the beauty of them is they don't go bad, unlike the other eggs that we have in our fridge. Like these can be used and thawed whenever you're ready to. We don't have any data to suggest that they technically go bad.
So once they're taken out of you, they stop at that age, basically.
Exactly. So those were my 31-year-old. Actually, I think I was, 31 years old at that time. So
okay.
Those are my 31-year-old eggs.
So is there like, let's say, okay, I'm in this process. I feel like for the very first time, I feel my biological clock ticking.
I know, it's so weird,
It's
right?
so strange because when I was going through the process of like finding a doctor to help me freeze eggs, I got so many no's. Like, well, we don't
really
we don't do this with women after the age of 42 or something. So, and 42 to me is like, it's like such a close cutoff for me. I'm 43, right? Mm-hmm. So now I'm like, oh God, do I need to start like getting all my eggs out before 44 or something like that? Or is it kind of like that span of like 6 months to a year is like not that big of a difference, or can it make a big difference?
It can make a difference. Earlier is better than later, but everyone's different. We have life that goes on. Sometimes 1 month won't work, but we still encourage people to move forward with the process sooner rather than later.
So take me through that process of freezing your eggs. You said there was injections and all that kind of stuff.
Yeah. So we usually try to time it based on where you are in your cycle, though sometimes some clinics will start with birth control pills. The role of the birth control pills is to basically synchronize the cohort of eggs that your ovaries brings to the surface every month. So when we're doing an egg freezing cycle, we're only able to access the follicles or the eggs that are on the surface that month. We're not able to tap into like the other eggs that are stored within the ovary. It's only those ones on the surface. So if you weren't going through this egg freezing cycle, those would have actually just like disintegrated and not been used.
Interesting.
So one of the common things that people ask is like, is egg freezing going to like speed up menopause, or is it going to harm my fertility later? Like, no, these are eggs that otherwise would have just gone away. So you come in at the beginning of the cycle, we see how many eggs or follicles that your ovaries have brought to the surface that month. And then we decide whether you go on birth control pills or whether you start with the injections then. And we give you injections that are similar to the hormones that your body's already releasing. That's called follicle stimulating hormone. And that causes these follicles to grow over the course of 10 to 14 days. And as you're coming in every several days, we check to make sure that the follicles are growing as we would expect. And we see whether we need to tweak your dose. We see if we need to add any extra medications. And then towards the end of it, you might feel a little bit of like pelvic fullness. You might feel a little bit of bloating. Some people feel some mood swings, but for the most part, people tolerate it pretty well. And then it ends in that egg retrieval process like we had discussed.
Do you, when you're taking this medication, like I know when I was on birth control in my 20s, I was hormonal and crazy and I hated sex and all of that kind of stuff. Does it kind of do the same thing to you? Are you going to gain weight, do all these things?
So long-term, most people don't gain weight from it. And over the course of 2 weeks, most people don't gain significant weight. But in terms of the mood symptoms, everybody is different. I always tell people, like, give yourself some grace. A lot of people end up feeling totally normal going into the process, but then it can sometimes bring up some emotions as you're going through it too. A lot of people don't necessarily plan on going through egg freezing or IVF throughout the course of their life. And then they end up, winding up in our office, and it's a huge emotional process for them. So I always just say, it's okay if you feel these things. We tend to recommend things like a therapist, acupuncture, things like that, continuing with moderate intensity exercise just to keep those stress levels down.
Interesting. Okay, so you start the injections. I heard it's a big needle.
They're not so bad for the stimulation. When we're putting the embryo back and we're injecting progesterone, that can be a painful needle. Yeah.
Okay, that's good to know. So I'm not going through that right now.
No.
Okay, that's good to know. Okay, so once you've done all the injections, I didn't realize you have to go back for monitoring every couple of days. Mm-hmm. So you're going to go in and you're like getting an ultrasound. Is that what's happening?
Yeah. So it's another transvaginal ultrasound every several days and labs to check your hormone levels to see how you've responded.
And are there things that you should be considering? Like, for instance, I'm low on iron. So my doctor is like, we should just do an iron infusion on you. Do I have to like balance these kinds of things out? Like, can I get my iron infusion and then start my injections?
Iron infusion should be totally fine. But in terms of like general health, like for like what to optimize going into an egg retrieval or IVF cycle, we usually say like things that are good for your overall health are good for your fertility. So I tell people to focus on like whole foods, organic foods, high quality things. Be careful of what you put in your body. Try to minimize exposure to toxins. So we say like eliminate things like plastics, nonstick pans in your house. Really just be observant of the things that you're using in your everyday life, because some of these things contain endocrine disruptors. Ideally, most of our nutrients come from our diet, but if we need to, we can also supplement with a prenatal vitamin because that can fill in some gaps as well. But otherwise, just focusing on like being healthy lifestyle and diet.
Okay, so then once you freeze the eggs, should you expect to then freeze eggs again?
It depends on the outcome and your goal. So usually after we see how many total eggs you got and then how many were mature, we usually sit down and have a conversation about like whether we're both happy with the result for you in the context of how many kids you hope to save for in the future. Mm-hmm. And if we're well below that goal, then it might be a good idea to go for another cycle. And sometimes people have to do multiple cycles to meet that goal.
Wow. Okay, that's good to know. All right. How far apart can you do these cycles?
Most people will offer them back to back.
Oh,
yeah.
Okay.
So it's usually you'll get your period after your egg retrieval and then you can start again. But, some people don't want to necessarily do that because it can be just like physically taxing on the body. So you can take a little break too.
Yeah. And do you gain weight? Did we talk about that part?
We talked about it a little bit, but yeah, most people.
This is on my mind. I'm over here like trying to be in shape and do all the things.
No, it makes sense. I did feel some bloating actually after my cycle and that was not fun. Luckily I have a job where mostly I wear like, glorified pajamas to work, but I did feel uncomfortable and I did have some bloating. So I do like tell people if you have like a really big event or like a wedding that you're going to be like maid of honor for, like you might not want to do it like the week before you're going to be doing that.
But it goes away like a week later?
Yeah, usually.
Oh, that's not bad.
Yeah.
People make it seem really bad. I see some really dramatic stories online.
Everyone's different. So that's why I say just like see how your body accommodates it and reacts, but most people tolerate it okay.
All right. So we're saying like 20s is the best timing to freeze eggs because they're the healthiest, right? But it's probably an expensive process for people. So can you let people know kind of ranges that they should be considering?
Yeah, there's no doubt that it's an expensive process. So it depends on where you are. They've looked at this in different cities, but the average range for IVF is usually between like $20K to $25K per cycle.
Okay.
The ideal situation is that your insurance or that your employer will cover some or all of the IVF costs, but it really depends on what your employer or even the state that you live in provides.
Oh, that's very interesting to know. And then there's also the cost of actually storing the eggs, right?
Mm-hmm. So it varies from clinic to clinic, but it's usually, about $500 to $700 a year once you've retrieved them.
Oh, so not as bad. So it's really the retrieval that's the most expensive part.
Mm-hmm. Yeah,
okay.
The initial cycle costs.
Yeah, but then there's also the process of making embryos, implanting them.
When you come back to use them, yeah.
Okay, so then what kind of expenses can people expect there?
It depends, but usually an embryo transfer cycle itself will cost about like $5,000 to $7,000, but the lab costs are a little bit different, several $1,000s on top of that too.
Right, because you're testing to see if they're genetically...
Yeah, and that's another option too.
Okay.
Yeah.
Okay, that makes sense. I'm sure you see this all the time. It's just like women who, go through pregnancy and labor. How can their partners best be supportive of this and be helpful through this process?
I think it's really helpful if you can come to the appointments. Sometimes, and at least I feel it's, I don't necessarily think of all the questions that I might want to ask, but it can be really helpful for them to step in and say, you actually were wondering about this last night at home. Why don't you ask that question? That could be really helpful. Sometimes just like a supportive hand as you're getting ultrasounds or labs done can be really helpful. Just helping them be part of the process with you. And then, of course, doing some of the things that you normally would be responsible for at home, like cooking, some of the chores. That is always helpful and appreciated for someone going through IVF.
Yeah, I mean, just in general, right? Let's be supportive partners, okay? All right. You were saying that, when embryos are viable and they have all the chromosomes, everything, they have a higher chance of taking. But I also have so many friends who like it just doesn't take. Like I have a friend who ended up moving to having surrogates because her body was just not taking. What are these factors? Like what is potentially happening in the background?
So let's take a step back here. So when we're looking at like the genetically tested embryos, the ones that have the correct number of chromosomes are called euploid embryos. And we usually say that euploid embryos have a 60 to 65% chance of resulting in a live birth. So it's not 100%. And when we've done studies, we usually say that usually 3 embryo transfers will get you there. But it's just a numbers game, right? You have to keep going in order to hopefully get that positive pregnancy test and then get that live birth. There are other factors, of course, that come into it. Euploidy, meaning having the correct number of chromosomes, doesn't guarantee that the pregnancy will implant. The embryo needs to have all of the machinery in order to correctly divide and grow. And the genetic testing that we're doing, which is called pre-implantation genetic testing or PGT, checks for the correct number of chromosomes, but not necessarily all of the things that are needed to develop into a normal pregnancy. There's also the uterus. We have to consider the fact that, there can be abnormalities in the uterus that we always check for. We check for polyps, fibroids, scarring, which may lead to failed implantation or a miscarriage. And there's also other conditions in terms of that patient's or that woman's overall health, which may impact the success of the pregnancy as well. So it's kind of like that whole big picture of evaluating who the person is, what the embryos look like, their genetic testing, and evaluating what their overall success rates will be based on that.
That makes sense. Is an indicator, if you've already had kids, let's say I already have 2 kids, right? And then now I've taken obviously a few years break. Is that an indicator that maybe I would have a baby easier through IVF? Or not necessarily?
Not necessarily, because it's a different environment, right? So those were, naturally conceived pregnancies when you were younger. But when we're taking control of your cycle and giving you medications and now you're older, maybe introducing a different partner into the picture, it can go differently.
Does a different partner make a difference?
It certainly can. I mean, remember, the sperm is 50% of the picture, right? So we want that person to be coming in good health as well. Ideally, someone who has minimized drinking, not smoking, including vaping, ideally no cannabis or marijuana use, healthy lifestyle, normal weight. We want the male partner to be in as good a shape as possible as well.
Yeah.
And we always recommend checking a partner's semen analysis early on in the process just to make sure that everything is normal from their standpoint, because we take on so much responsibility as women.
It's true. We always do. We always do. I remember thinking this when I was in my early 30s, and the topic of having babies start to come up with my husband at the time. And I kept having so many friends that were going through this fertility process. Mm-hmm. So many of them, even though they were healthy, were going through IVF because they weren't able to conceive. And so I was so worried about it. But I was like, I don't want to go through that process. I was in the if it's meant to be, it'll be mentality. It's so young of me. So young and immature of me to think this way. But it was the way I was thinking about all of it. But I really did feel this concern that maybe I wouldn't be able to conceive naturally. What is it? What are these factors that are coming into play? Why does it seem like so many more people aren't able to conceive even at a younger age?
I think wow, that would be $1 million question.
I know,
if I knew
right?
all of the answers to that. But these are some of the answers. Well, one, age does play a component. I know you said even at a younger age, but we are trying to get pregnant at older ages than in previous generations. It's a cultural shift. Many of us are prioritizing our education and careers, but we're also seeing that there's things in our environment that are probably impacting our overall health as well. So that's why I brought up those other things like endocrine disruptors and overall healthy lifestyle. There are probably many things that a lot of us could tweak in order to optimize our general health.
I mean, because I see so much mixed information about the endocrine disruptors, right? Do you think it's just being better safe than sorry, I guess, because we're starting to see some evidence about these forever chemicals and
microplastics everywhere
and stuff? Yeah.
I think that we have enough evidence to suggest that we have these chemicals inside our body. So if you have the ability to minimize your exposure, why not do it? If you have the ability to switch out your Tupperware from plastic to glass, do it. If you have the ability to switch from a nonstick pan to a cast iron, even though it's a pain to cook with those, it is better.
Okay, that is good to know. Are there other things that you want people to know about their fertility, when they're starting this journey, whether it's to conceive naturally or go through IVF?
I think the number one thing that I would want all women to know is an understanding of what an AMH or anti-Mullerian hormone level means. I can't tell you how many times I've gone to dinner with friends where they'll say, oh, I actually went to the gynecologist the other day. They checked my AMH level and they told me everything's going to be fine. We're not ready to try to have kids yet, but they told me everything's looking good. But I think it's really important that all of us know what this level means. So just to back it up, AMH is a lab that can be drawn from our blood that stands for anti-Mullerian hormone. and it's produced by the granulosa cells around the follicles in our ovary. So it kind of gives us kind of like checking your bank account, like a sense of like how many eggs we have in our bank account. It doesn't tell us how easy or how hard it will be to get pregnant in the future. It really tells us, and I use this number as a fertility doctor to tell people how efficient that I think that their IVF cycle or egg freezing will be if they were to go through that process. The reason why it doesn't tell us how easy or how hard it will be to get pregnant is because multiple things need to happen in order to get pregnant. Your ovaries need to release an egg from the ovary. The sperm needs to find the egg and fertilize it. Your fallopian tubes need to be open and pick it up. And then the pregnancy needs to be able to implant in the uterus. So all those things. So just telling us how many eggs you have in your ovaries doesn't tell us how that whole series of events will play out. And so a lot of us are getting our ovarian reserve checked either with ultrasound, with the antral follicle count telling us how many follicles we have. A lot of us are getting this lab done, the AMH level. And I would love for every single girl to be able to shout from the rooftops what it genuinely means. It doesn't tell us how easy or how hard it will be to get pregnant. It's not exactly a fertility test. It just tells us how many eggs we have.
Got it. That is good to know because I actually just went through all those tests. I did the ultrasound. I did the AMH.
Okay.
I think I'm good.
How did it go?
I don't know. Actually, I missed my appointment.
No!
That was my fault. I missed my appointment to discuss the results and then to like move forward with the process. When we were doing the ultrasound, he said it was looking good.
Okay.
Yeah. So that's good.
Positive.
Yeah. So and obviously he wants to move forward with the conversation. So I think that it looks good.
Okay, you'll have to keep me posted when you get your follow-up.
I will. When we freeze our eggs, can we, and we use like another facility, can we then eventually in the future move to like another doctor?
A lot of the times, yes. Usually the labs will have to see what technologies were used and the processes that were used just to ensure they're up to their standards.
Ah, that makes sense too. Should you maybe like, if you've got the ability, the means, should you be like maybe going to a few different places? And
you're going to have like your Miami eggs, your Beverly Hills eggs.
Why not?
It's not about, I've seen patients who have done that. In this political climate, some people do want to have eggs or embryos stored in different states where there's less, restrictive reproductive health laws. So people do think about that. But I think for ease, it might just be easier to have them in one place, especially if you're located in one place, but you're a jet setter. So it might just make sense for you to do it wherever you are.
Hilarious. I love that. How about for people who want surrogates? Like, is there something, like I was saying, my friend tried to implant her embryos and it came down to like, she had like 5 eggs left and or embryos left and she didn't want to chance it. And so I think it's now, so she had only a few eggs. Maybe I'm making up that number, but she didn't have as many eggs left or embryos left. So she was like, we're going to do a surrogate. So they do a surrogate. And then I like start learning all about it. And I was kind of blown away by the concept of the surrogate. Yeah. But how do you even like choose? Like what should you be asking your potential surrogate to know that they're like the right host for your baby?
It's a good question. So we use the term gestational carrier now, or GC, and this is referring to someone who is carrying the pregnancy for you. You bring up a good point, right? Like, how do you know how to find that person that's a good fit for you? How can you trust that person? And usually people go through agencies. There are some that are more reputable than others. So usually your clinic will be able to connect you to one that's considered to be like a reputable agency. And then from there, you go through different profiles of different individuals and you see whether, their lifestyle, their location, their medical history would be a good fit for you. Ideally, a gestational carrier or a GC should be someone who's completed having childbearing herself. So she's done having children for herself. Ideally, she hasn't had any complicated pregnancies, right? Because in order to be a gestational carrier, you really are assuming the risks of the pregnancy. And pregnancy is not a health neutral event. You've been through it, right? Like it's serious stress on the body. So even if someone is receiving money for this thing that they're doing for another person, we have to be good stewards and make sure that they're not taking on excess risk that's unhealthy for them. And then they also come in for health screenings and evaluation, and we make sure that all of their blood tests are appropriate, that they don't have any infectious diseases that they could pass on to the pregnancy. And then also the couple and that gestational carrier have to go through legal and psychological clearances just to make sure that everyone that's involved understands the kind of the gravity of using a gestational carrier, because it's really, really different than carrying a pregnancy yourself.
You know what's funny is I was at a barbecue the other day and I sat next to this woman. I'd never met her before. And somehow the topic comes up that she has been a surrogate.
Really?
She's got 3 kids of her own. And then she was like, I just didn't feel like I was done having babies. And so she said her husband was done though. So she decided to be a surrogate for her gay besties, right? And
that's such a nice gift.
Right? I know. I was like, geez. But she brought up something that I was like something I hadn't even considered. And she said that it was during the time of Zika, when Zika virus was like a big thing in Florida. And she said that they were trying to make her sign a contract. And she's a married woman, sign in her contract that she would not have sex while carrying their baby. And apparently they weren't able to enforce this. But it occurred to me in that very moment that your surrogate could be having sex while pregnant with your baby. Does that have any potential implications for your baby?
From a health perspective, generally not. As long as your pregnancy is low risk. In the same way that if you are carrying your own pregnancy, you can technically have sex. But yeah, there's a lot of considerations that go on when you're bringing someone that you might not be able to watch all the time, or you're not with them all the time. So you want to make sure that your pregnancy is being cared for in the healthiest way.
Yeah. Yeah, but their reasoning was Zika, right?
Yeah, exactly.
If her husband was apparently for work traveling to South America a lot, so they were really concerned about it. So it actually felt fair.
No, that makes sense.
Yeah.
Zika had some serious implications for the development of pregnancies. I was actually in Miami as a med student at the time while all that was going on, and it was very, very scary.
Yeah, I can imagine. So are there other things that people should consider if they're like, maybe I don't want to carry the baby, but I want to do IVF and embryos and everything, so I'll just do a surrogate. Should they consider other things with surrogates that you've seen?
I think just making sure that the connection is really there. People have different relationships with their GCs, but I think the ones that I've seen really work well are ones where there's really good lines of communication between the intended parents and the GC. Oftentimes we'll FaceTime, or the intended parents will actually be there at all of the appointments. So it makes them feel like they're really involved. And even sometimes those deliveries can be really beautiful where, the intended mom is going to be in the room supporting that GC during the delivery. And then as soon as the baby is born, the baby goes straight to the intended mom's chest.
Yeah.
So it's nice if they're able to develop that bond over the course of 40 weeks.
I love the term GC, actually. It makes it sound so much more professional. But I do love that concept of, I feel like if I were to ever use a GC, I'd be like, you're going to be part of the family.
Yeah, it's come on in, girl. This is your room.
Yeah, we're going to take care of you. I'm going to feed you the best food. You're going to have the best life you're going to ever have for these 10 months.
Yeah, no, it's true though, right? No one is going to care more about, your pregnancy than yourself. And there are so many good reasons why people use GCs, but ideally this is someone that you can trust and that that they're putting themselves in safe situations and that they're doing safe things with their body.
Yeah, makes sense. Well, this was such an informational, I feel like I learned so much more even than my own process of going to see my own doctor. And nothing on him. I just feel like these it's it's my time and his time and everything. Whereas I've actually had a chance to sit down with you and really discuss this. So I'm sure that everybody listening, if they were interested in this topic, they've learned a lot.
Good. I'm so glad. And I'm always happy to talk to you about your results whenever you get them back.
Sounds good. Thank you. So fun. Thanks for joining us on this episode of My Life Online. If you enjoyed this podcast, make sure to follow, rate, and review, and also share it with a friend so we can continue making great episodes for you. You can also find me on social media. I'm at Susan Yara. And if you enjoy beauty, especially skincare, make sure to check out my YouTube channel, Mixed Makeup. I'll talk to you soon.